abdominal wall. You may have heard of the inguinal canal, or if not that, an inguinal hernia. All right, and which is a weakening of that wall. And they end up in the scrotal sac. So that occurs along a band of connective tissue. You can see it on this view, sliding posterior to the peritoneum and then into the scrotal sac. Here's an anterior view. And usually by gestational age of 7 months, they are present in the scrotal sac. So when a baby boy is born, obviously he would be born as a baby. When a boy is born, the OB or the pediatrician both will palpate the scrotal sac to see if the testes have descended. If they haven't, it's not going to require emergency surgery, but they need to descend before the child reaches puberty. If not, he'll become sterile, all right, because of the higher temperatures that are present inside the abdominal or pelvic cavity. But sometimes surgical intervention might become necessary if it doesn't already occur. So this band of connective tissue is known as the gubernaculum testes. So I'm going to kind of illustrate how that occurs. There is upper gubernaculum and a lower gubernaculum. The upper gubernaculum testis disappears, and the lower one continues to shorten. So this is the scrotum, and we have the testis. This is attached to the inferior aspect, the bottom of the sac, and it degenerates over and over in a kind of an overlapping fashion as it shortens. And as it does so, it pulls that testis down along the posterior wall, into the pelvis, through the anterior abdominal wall, and down into the scrotal sac. So eventually, this would result in a very short gubernaculum as the testis resides in the scrotum. Now when we talk about the female reproductive tract, obviously there's a lot of overlap. Okay, similar or homologous structures. So in the female, attached to the ovary, there is also an upper and a lower gubernaculum, and those both remain as ligaments that support the ovary and the uterus. So I'll remind you of that fact when we get to the female, that these are homologous structures. The gubernaculum in the male is homologous to the ligament in the female. So as it passes through this channel, both male and female are going to have inguinal canals, but the male is larger, and the male is more likely to develop an inguinal hernia, because in the female, the only thing passing through the inguinal canal is the ligament. The male had that gonad passing through, along with the vas deferens that's still there, and blood vessels and nerves. So it maintains a larger opening, and therefore that opening can be stretched, or the canal itself can be penetrated by a loop of intestine. So let's look at the structure of the inguinal canal and the contents, the spermatic cord, and then we'll look at how we define direct and indirect hernias. So obviously we're no longer in the embryo here. At least it's been circumcised. The scrotal sac is here, and it has an external layer of skin. We'll be looking at the connective tissue. And the canal is a tunnel, if you will, that passes through the abdominal wall. So there's an opening between the anterior abdominal wall, just above the rib of the pelvis, and the scrotal sac. And that would be this space right here. So this thickening, an arching of connective tissue, is the external opening. And if I could grab this in my hand here, I would be holding on to wrappings of the spermatic cord. There is an internal opening as well. So testicular artery and veins, the vas deferens coming from the epididymis are going to pass into or out of that. So from the deep side, we have a deep root. We have a